How much would a hair implant cost for me? I'm looking to fill my hair temples and was wondering how much grafts I would need. Thanks.
Thank you for your question. You're asking the most common questions that people ask when they're trying to combat their hair loss, which is how much will a hair transplant cost and how many grafts do you need? And this is understandable because the reality is that for the longest time, the only solution for progressive hair loss to improve the cosmetic appearance was hair transplantation. And unfortunately, the industry of hair transplantation has become so commercialized that people think of it in a commoditized way where people sell, quote, hair at a cost per graft and offer specials and all kinds of things. But I think many of the doctors practicing hair transplant and doing this aggressive selling are not informing adequately the patients that they will continue to lose hair. And so when I look at your photo, it's clear that your hair loss is fairly advanced. So in your question, you didn't mention whether or not you were taking finasteride to try to stabilize your hair loss. You see, hair transplant isn't usually a single procedure. And because the challenge with a hair transplant is to achieve a density that will give you coverage that is consistent with what nature creates. The limitations of hair transplantations have to do with the number of hairs available in the donor area and the number of hairs that can be transplanted in a square centimeter. You see, when you look at the donor area, the true donor area, that means the area of the band of hair that the baldest man you've ever seen still has, that's what's called genetically resistant. And that's the area where we harvest hair grafts. So there's that technical limitation. And then two is the number of hairs in a square centimeter. So when you go into a bare scalp and you're trying to put as many hairs as you can in a square centimeter, there is no duplicating what nature has already created. In other words, when nature has put hairs together, they're clustered in a way that's much more dense than what a surgeon can do. And the reason is that when you place a hair graft, you have to have a certain perimeter of skin in order for that hair graft to survive. Survivability is a big issue with hair transplant surgery. What I'll tell you is that we do in our practice is that in a patient like yourself who does ultimately need some kind of hair transplant surgery, we first aim to stabilize hair loss. And we do this with medical therapy, such as the use of finasteride. And the challenge with that option is that many people are concerned about long-term sexual side effects from finasteride, which has made it a very unpopular drug these days. We've developed an alternative called hair regeneration, where what we have figured out based on observations we made when we used this stem cell-based wound healing technology years ago for transplant surgery, that we can make thinning hair thicker, and we're able to actually restore a lot of hair without doing surgery. Now, as a general rule of thumb from clinical observations we've made over several years, is that if an area of skin hasn't had hair for more than 5 years, it's not likely we'll be able to regenerate. There are always exceptions to that statement, but we try to give our patients very realistic expectations. However, on the flip side is that in the right candidate, we're able, with an injection, generate enough coverage that exceeds the results of 2 hair transplants, which is very significant given how long it takes to do a hair transplant, which is usually 6 to 8 hours, and how long it takes to see the results, which is about a year. We've had patients see dramatic improvement in less than 6 months. Now we don't want to generalize. We always want to emphasize that every patient is an individual and we follow our patients very closely. So for someone like yourself, hair regeneration would be our first line of treatment. We've actually almost ceased doing transplant surgery because we've gotten such great results, and when we explore the options at a year, 18 months or so after the injection, most of our patients are satisfied and happy with the results. So I would suggest to you that before you go into the rabbit hole of finding the best deal for a transplant, or to find who's going to do the most grafts, because remember there's always a limitation for the number of grafts you can have, that you learn more about your options for stabilization. I will say to my patients when we do this injection is every hair I'm able to regenerate or effectively improve its thickness and quality is a hair I don't have to transplant. And that means that you can more strategically use the hairs in the limited donor area for grafting where you need it the most. So learn more about these suggestions I've made, and meet with the right doctors with the experience with this new technology that I've described. So I hope that was helpful. I wish you the best of luck, and thank you for your question.